please feel free to go ahead and put them in. And then I will go ahead and start recording and get going with alignment. Alrighty. Perfect. I see that on the screen. Okay, I'm just gonna stop share for a minute. Awesome. And now I will just go back to getting recording going and getting started on screen share. All right. So again, this is mini training number 6. This is alignment. And I am DL Walker. I am trained as a physical therapist, as well as earning degrees in exercise science, cardiac rehab, and fitness. To learn more, you can go ahead and take a look at fixyouonline.com. On YouTube, there's Fix You Online TV, which we're streaming live right now, and a Facebook group called Fix You Online. So feel free to check out any one of those and reach out to me accordingly. So with that, we'll get started on alignment. And as I said yesterday, alignment within the body is also known as your posture. And many people understand that posture is important. It can be important emotionally. It's certainly important physically, and it will be used interchanged with alignment. So when I had said our bodies are kind of like our metaphysical cars, right, that are driving down the highway. You know, which body are you driving on? Are you the Mercedes or are you this old Volkswagen clunker? Because what I talked about yesterday with regard to the feet are like our tires, right? And most of us are walking or driving, metaphorically speaking, on tires that are low on air or flat altogether. That doesn't necessarily mean flat feet, but I just mean that they are out of alignment, and the foot is our base of support, and it's like the foundation of a house or the wheels on a tire. So if they are not working properly, it's going to affect the rest of the body. But there's also malalignments that occur above the foot. They can occur anywhere in the body, and I'm going to give you some examples of those. So here's some facts, and according to a report from the Institute of Medicine, more than 100 million Americans suffer from chronic pain at a cost of $600 billion a year in medical treatments and lost productivity. Many of these individuals are being treated with medication. Very few of them are receiving good physical therapy, particularly they are not addressing the underlying cause of the chronic pain, and therefore just costing the country more and more money and costing individuals more and more quality of life. And in 2019, there were a total of 700,000 joint knee replacements that year, and approximately 400,000 hip replacements. So over 1 million joint replacements just in the knee and the hip. There are also now joint replacements available to other joints, including the shoulder and the elbow and such, although they are less common. So I had said yesterday, and I'll say it again, alignment dictates function. So there's something called the length tension ratio, and it states that a muscle will contract with greatest vigor or strength when it is at a particular length. If it's too long or too short, then it will not work optimally. So what you can do to test this is stand against the wall, and you can bring your knee up toward your chest and go ahead and then push down onto your knee with your hands and try to push that knee down. Now go ahead and take a seat and repeat that activity with the same leg, with the same amount of force, and you should notice a difference. You are going to be stronger in one position versus the other. And you can go ahead and share which position was stronger for you. But the reason that you are stronger in one position versus another is because of the length tension ratio. Also, alignment dictates frequency. So again, our nervous system, right, conducts messages from one nerve, the end of one nerve to the beginning of another. And if a signal is dulled, right, then the manifestation can be decreased reaction time, paresthesia, and maybe even impotence. So if there's a malalignment between the axon, the end of one nerve cell, and the dendrite of the other, then there could be problems there. There's also an electromagnetic field, which is less known to us, that's said to regenerate in response to regenerate tissues and adapt to forces, as well as be responsive for circulation. And then, of course, energetic medicine, which is really becoming more and more interesting, more and more popular, and more is becoming known about it. But we have these acupressure points on this picture here. These are our chakras, right? Well, what if your chakra is off, right? It could be malaligned because your posture is malaligned, and these chakras and these acupressure points are within our body, right? They're on our body. So therefore, if there's a malalignment in the body, it can affect, theoretically speaking, any of these different points. And then also emotions, and there could be the frequency of emotion. So when you are in a poor posture, it can affect you in an emotional aspect, as well as a number of different manners. So, all right, so moving on, what we're going to do is then talk about alignment dictating flow. And this again comes into place with conduction from nerves, as well as circulation with regard to blood flow. So you see this hose right here. If I turned on the water would not flow as easily as it would if this hose was unwound. Or a lot of times we'll get kinks in our hoses when we're trying to water our plants. Well, our arteries are very much like a garden hose. And if there is a kink or a constriction in the artery due to connective tissue or due to a malalignment, it can lead to decreased circulation. And particularly think about the carotid artery leading to the brain that leads to stroke, fatigue, or dementia. So there is a professional football player, he is now retired, by the name of Jim McMahon. He was the quarterback for the Chicago Bears, and he requires weekly adjustments by a chiropractor to keep circulation to his brain because of the many traumas that he sustained during his professional career. So I want to dictate give you a little activity to do right now that really demonstrates this alignment issue with regard to function, frequency, and flow. And so what I would ask you to do is, you can be standing or sitting for this, but I need you to sit tall and sit straight with your head aligned over your shoulders. And I want you to go ahead and first, you can breathe in deeply in through your nose and out through your nose. And notice how that feels, right? The second thing, I want you to now pretend that you're swallowing an imaginary piece of food. So go ahead and pretend you have food in your mouth and go ahead and then swallow. Now, what I'd like you to do is I'd like you to assume a rounded shoulder posture, bringing your head forward because that changes our center of gravity by rounding our shoulders, so we have to offset all of this. And now go ahead and breathe in again through your nose. And breathe out. Now go ahead and swallow that imaginary piece of food. Okay. You should notice a significant difference in the ease with which that you're able to perform both of those activities. So I have even worked with pulmonary patients and just worked on their posture and have improved their pulse oxygen recordings during a therapy session. So again, when you think about it, the digestive system is a series of tubes, as is the respiratory system. And if those tubes are not in a good alignment or the proper alignment, again, they are not going to be able to function optimally. And optimal is what we are shooting for in our lives, because there are certain things that we can control, like our alignment, and some things that we can't control, like our age. So again, why don't we take the things that we can control and do something about that, versus worrying about the things that we can't control in our lives. So moving on to back to the presentation. So a question is, how do you feel at the end of your day, right? And this was where my career literally changed, and I'll tell you how. So I was probably in my mid 30s, and my job involved, I was treating patients in their homes in New York City, senior patients, and I love being active. So I would rollerblade through Manhattan, sometimes into Brooklyn, over bridges. I never went through tunnels, but I went over bridges on my skates. And I could typically get to a place as quickly as I could if I took the subway or mass transit. So I would wind up doing about 10 miles a day on my skates. So I stayed in extraordinarily good shape. But obviously, I'd be rollerblading 10 miles, I'd be treating patients, all very physical things, right? At the end of the day, I remember feeling, pretty exhausted. And I went to a continuing education class that was taught by my mentors. And the idea of alignment really struck home with me, because I had always understood the importance of posture, particularly knowing the lane tension ratio, which I learned in graduate school. And I thought I was in the right posture because I was standing with my shoulders back and my chest up, like we're taught for a military posture. And what was so interesting was that my instructor said, no, that's not the right way to stand. I'm like, what do you mean? I've gone to physical therapy school. I've read research. This was the first time I heard this. And what this individual did was they took my rib cage and they instructed me to do a couple of things to kind of get it mobile. And then they placed my rib cage over my pelvis. Because when I'm standing, when we talk about center of gravity, right? If my shoulders are back, I'm going to accommodate by kind of arching my lower back forward to maintain balance, right? It's all about maintaining balance. So this person, I was then adjusted, and I took 3 steps. And I am very mindful within what's going on in my body. And I said to myself, wow, I can't believe, the difference in walking with my rib cage over my pelvis. And I thought to myself, oh my gosh, how much energy am I wasting during my day by being in this inefficient posture? So I immediately actually signed up for their next continuing education course, which was a week after, and then spent the next several years working with this group of people and learning these various techniques and understanding the importance of alignment. Because it was in that class that this person said, the instructor said, that if you are in the perfect ideal alignment, every step that you take is an abdominal exercise. So you don't have to waste your time doing crunches or doing abdominal exercises if you are in the proper alignment. And if you are in the proper alignment and you're active throughout your day, you do some activity, then life is your exercise. And what better way to stay fit and what better way for time management to be fit by just doing the things that you do in life, but having that be done on an aligned posture. So this is not just important for lay people. Here are 2 of the best tennis players ever. Okay, on the screen, looking at my screen, looking at it, on the left is Pete Sampras, and on the right is Roger Federer. And what you will notice, they're both performing a backhand. And what is interesting is that looking at the alignment of the neck and shoulders. So even, I didn't know a lot about physical therapy or posture at the time, but I always knew that Pete Sampras's posture was egregious. And again, I couldn't imagine why he was such a good player because he had such a poor posture. And look at him here. So look at his shoulders. Shoulders are elevated, right? He's not recruiting the proper musculature. He's overusing his upper shoulder muscles. His head is forward. That's going to actually even affect peripheral vision by having a forward head posture. And he just kind of looks uncomfortable doing this versus Roger Federer, who is kind of relaxed. His shoulders are down. He's watching, they're both watching the ball, but he's doing this on a more aligned posture. So let's look at their careers, okay? So here's Pete Sampras. He had a herniated disc at age 28. He had tendonitis at 29 and a rib strain at age 30. He went from number 1 to number 7 in those 3 years, and he decided to retire at age 31. Now, Roger Federer currently is ranked number 4 in the world. I just looked that up. He is 39 years old. In his career, he played over 700 consecutive matches before having to withdraw from his first tournament in 2008 at the age of 27, which is when Pete Sampras was breaking down. So again, Roger Federer, I had just actually read that he underwent his second surgery in his career. His first one was in 2016, which was then 4 years ago and at the age of 35. And he rebounded to win 2 majors after that. So what's happening now in tennis is that typically the professionals are spending more time in the training room, or as much time in the training room as they are on the court, because the alignment issues, the muscular issues need to be addressed, particularly at this high level of sport. So again, there are these guys. Here's Roger Federer, great alignment with his shoulders and good alignment over his torso aligned over his pelvis. Sampras, forward head posture, kyphotic, okay, so an increased roundedness in his thoracic spine, forward head and neck, and he's not going to generate as much force as Federer, and certainly his body did in fact break down. It's difficult to note where his alignment is, but typically if you have a rounded shoulder posture, then you are in front of your pelvis. And again, that will alter your center of gravity, your ability to balance and ability to function. So what causes misalignments in the body? Certainly trauma, okay? So when you sustain a trauma, energy is not created nor destroyed. So it does need to be released. So any bang, nick, cut, wound will create scar tissue in some way, shape, or form. And the longer that you have this kind of trauma, typically there is also an adaptation to avoid the pain associated with the trauma. So that is one reason. The second is pregnancy. Okay, and pregnancy happens over time. That's a hard one that I found in my personal life to get over. So, again, you are, your posture is changing. It has to. Okay, this is not to say that, you should try to alter your posture when you're pregnant. You can't, because of the changes, right, in your balance or center of gravity. You don't want to fall when you're pregnant. And certainly you have to adapt to a new kind of posture. And then things change all at once, but the body does not come back. And I think that that's why 80% of women who give birth vaginally will have postpartum stress incontinence. And there's a good number of women who also experience that, who do not give birth vaginally, who have had C-sections. In utero, so a fetus can have misalignments, and that's why young infants develop something called torticollis, where their neck is turned. And it's their position in utero against the organs of the mom. If the mom has restrictions in their organs, right, they're not going to be able to accommodate to a growing fetus, or like a rib, for example. So again, it's important for the mom to have good mobility in her organs as well as her skeletal system to adapt to a growing fetus, particularly in multiple births, meaning twins or more. The next one is habitual patterns. So if you're doing the same thing in let's say your work, then oftentimes you will develop imbalances, right, in any part of the body. So if you're doing something to one side all the time, it's really important to go ahead and do it to the other side. Golfers in particular, they swing from one direction, right? But that's great for their swing, but not for their body. They really have to offset any of those movements with movement in the opposite direction. Really important to be mindful of and to address. Certainly prolonged sitting or any prolonged position. So what happens, and this would go along with immobilization and driving in the car, is that your connective tissues will then start to adhere to one another when you're in a position for too long. The body was meant to move and be mobile, and even just tiny movements. And when you are immobilized, certainly in a coma, for example, it's imperative that a person receive range of motion treatment and be moved in order to prevent these connective tissues from adhering and causing problems with range of motion. That's why individuals are put in splints, for example, at their ankles so that they don't lose dorsiflexion, because when you're lying down, your feet are not up, they're just resting. And that's why over time, that's why things like plantar fasciitis hurt first thing in the morning, because you've been kind of immobilized to a certain extent or not moving for a period of time, and these connective tissue can adhere. So if you're in a cast, if you're in a boot, if you're in a brace of any kinds, that can cause a misalignment or restrictions in the body that can alter your alignment over time. So how do you get rid of it? Well, this is introducing the Walker method, which for those of you who work with me for foot and ankle, this will be very, very familiar, because it talks about 3 steps. And the 3 steps are, when you're out of alignment, okay, the connective tissues will adhere. Like I said, prolonged sitting, immobilization, any of those things that we talked about. And when connective tissues are adhered, they need to be released. And stretching is not the same as release. Okay, release is actually getting into the connective tissue and causing kind of a movement in that connective tissue that now allows freedom of movement. And it's highly specific. It's most effective when it's highly specific. But typically, even by most professionals, they are not specific at each individual point. And the next step is to realign. See, so you can't realign if you're not mobile. And you need to be mobile at every joint, at all connective tissues through the body, because one can affect another. And so only when you have range of motion that does not get compensated to that range of motion in another area of the body. So what I mean by that is, if I went ahead and lifted my arm, right? Okay. But I'm then having to go ahead and lift up as high as I can, but then I go ahead and arch my back. Well, that's not improving my arm range of motion at all. It's compensating with my back. So a lot of times people will do things like this to lift their arms up, and that's not true range of motion, and that's not the way to realign. And then lastly is reinforce or rebalance. So only when you are realigned, then you can take into account that length tension ratio and reinforce it by just doing simple activities. Now, there's some activities that are more targeted to particular areas, particularly that need to be taken care of. And that is part of the Correcticise program, where they are corrective exercises that are designed to correct misalignments and also performed correctly, in addition to a total body renovation called the $1 million body renovation, which will incorporate release of the connective tissues holding people in a position where they cannot get aligned. Because many people will try to realign by doing postural exercises that require a lot of thinking, but it becomes a lot easier if the body can just be relaxed and in the proper alignment 24/7, or at least 80% of the time. Okay, if it's 80% of the time, it's going to be 80% of the time that you are going to be in a better alignment for your health, for your functioning, for your decreased wear and tear on the body, and then also for enhancing the strength and the vitality that you regain. Because like I said earlier, there are certain things that we can't change, like our age, but look at Roger Federer versus Pete Sampras, right? Two professional athletes, two highly skilled, gifted tennis players, but look at the career of one versus the other, and when one broke down versus the other. Really a great example of the importance of alignment and the importance of addressing alignment if you want to perform just in your daily life, whatever it's important to you, but to decrease that likelihood of injury, to enable you to go ahead and get function about in your daily life without damaging, right? Like Sampras did at his late 20s versus Federer, who's still going in his late 30s. So, just yesterday, a friend of mine shared that family member had fallen and broke their ankle, and now they're hospitalized. And because of the virus, they're not able to visit their family member, and that person might be in there for a long period of time. I think that is really disturbing, because when you are injured, you really do need an advocate there to make sure that everything is going smoothly. Particularly in the U.S., this happens to be in a different country, but my thought is that's why I'm doing this, because if she had done my program, there's a good chance that maybe she just would have sprained. Maybe there wouldn't be a break. Maybe there wouldn't be an injury at all. Just like when I tripped down, 2.5 feet worth of stairs and did not fall and did not substantially injure myself. So again, just food for thought here. And tomorrow I am going to go further into the Walker method and probably show you a release technique that I use and get you familiar with that. So I will come back on and see if there are any questions, which there are not. And so in that case, I will go ahead and just quickly check on YouTube. And just see. And I am not seeing any questions on YouTube either. So I will go ahead and wish you all good night or a good day whenever you're watching this. And I will look forward to seeing you tomorrow, where we'll talk about the Walker method. Ciao.